Ever wish you could get a real cheat sheet for a major life transition?
Mm.
Armed with facts and clear choices instead of feeling totally swamped.
Mm.
That's exactly what we're diving into today. The often misunderstood world of menopause.
Right. And our mission for this deep dive is specifically tailored to help you cut through the noise and confusion surrounding this natural milestone.
Yeah.
We're here to extract the most important nuggets of knowledge from a truly comprehensive guide, giving you a shortcut to being genuinely well-informed.
And trust me, this deep dive matters.
Mhm.
Menopause is a natural transition. Okay, it's not a disease.
Exactly.
But it brings a whole spectrum of symptoms
Yeah.
and, crucially, long-term health implications. Did you know that around 1/3 of a woman's life is actually lived after menopause?
That's a powerful point, and it's why understanding this phase is so vital. But here's the truly empowering news. While those risks exist, there are, so many proactive preventative steps and effective options available. Our goal is to equip you with that knowledge. We'll be drawing our insights from the Menopause Maze, the complete guide to conventional, complementary, and self-help options by Dr. Megan A. Errol and Liz E. Dong.
Okay.
It's a really timely guide, incorporating all the updated major Menopause Society guidelines.
Great source. So let's unpack this. Let's start by setting the scene. Understanding the physiological landscape, the common symptoms, and how this transition impacts your wider life.
Sounds good.
What's the one crucial distinction about menopause and perimenopause we should highlight right up front? Because that often gets misunderstood, doesn't it?
It really does. That's a great place to start. Think of menopause itself as an official finish line. It's clinically defined as 12 consecutive months without a period. The average age is 51.
Okay, 12 months.
But the key takeaway, and what's often misunderstood, is the extensive perimenopause phase. This is the often long and winding transition before menopause.
Right.
It can last anywhere from 5 to maybe even 10 years. And it's when those first subtle, or sometimes not so subtle, changes truly begin.
5 to 10 years. Wow.
Hmm.
And these changes are primarily driven by hormonal shifts, right?
Exactly.
When the source dives into the different forms of estrogen, oestradiol, estradiol, what's the practical takeaway for our listener? Does knowing these names actually help?
That's a great question because it can definitely sound a bit like medical jargon.
Yeah.
The main point is that oestradiol is the strongest form, and it's the most common one used in hormone replacement therapy, or HRT,
Okay.
because it's what your ovaries produce most when you're fertile. Oestradiol is what your body primarily produces after menopause. If you're not taking replacement, it comes mainly from fat cells.
Oh, right.
And estradiol is a weaker, often considered protective form. Knowing this just helps demystify, what's an HRT or what naturally changes in your body.
So you can have better conversations with your doctor.
Precisely. More informed conversation.
Okay, so that's the underlying machinery. Now, what about the day-to-day experience? Let's talk common symptoms like vaginal changes and libido. Those come up a lot.
They really do. This is a really common concern. Due to declining estrogen, the tissue lining the vagina can become thin, dry, and inflamed.
Right.
It's a condition known as vaginal or urogenital atrophy. And this can cause discomfort during intercourse, which is often a big factor in decreased libido for many women during perimenopause and beyond.
And it's important to know it's a direct physiological effect.
Exactly.
Yeah.
It's not just psychological.
Migraines are another big one, and they often seem linked to hormones.
Mm-hmm.
What does our source say about their connection to this transition?
Oh, absolutely linked. Our source highlights a pretty striking point. Around 2/3 of migraines in women are connected to fluctuations in estrogen.
2/3.
Yeah. The key insight here is that while many common triggers exist, bright lights, lack of food or sleep, stress, certain foods, the hormonal roller coaster of perimenopause can actually worsen them.
Right, so even if they get better later.
Exactly. Even though they might improve post-menopause when hormone levels stabilize at a low level, that transition period can be brutal for migraine sufferers.
So if you're getting new or worse migraines midlife,
Definitely consider hormones as a primary suspect and talk to your doctor about it.
okay, heart palpitations, that feeling of your heart racing or pounding, that can also be unsettling, right? What's often behind those?
Yeah, they can certainly be alarming. They're often triggered by things like adrenaline surges or even rich or spicy foods, maybe too much caffeine or alcohol.
Common triggers.
But, and this is important, underlying causes can also include things like an overactive thyroid, low blood sugar, anemia, or even low blood pressure.
Okay, so not always just menopause itself.
Correct. The crucial takeaway is, if they become frequent, or if they happen with other symptoms like dizziness or shortness of breath, It's absolutely essential to get medical help. Don't ignore it.
Got it. So alongside these often unsettling physical sensations, the internal landscape also shifts significantly for many women.
Hmm.
That brings us to another critical area, the psychological symptoms.
Hmm.
These can range from just a general low mood to actual clinical depression and anxiety,
Hmm.
right? Like tension, nervousness, panic attacks.
Yes, and these symptoms are a powerful demonstration of that mind-brain-body interface we talk about.
Right.
They can be both directly hormonal and psychological, with each influencing the other. Understanding this connection is really key to managing them effectively.
Because what affects your mood affects your body, and vice
Right.
versa.
Precise.
Insomnia and sleep disturbances also plague so many women during this time, often adding to that mental load.
Absolutely. The source notes over 40% of menopausal women experience sleep issues.
40%.
Yeah, whether it's difficulty falling asleep, staying asleep, or getting back to sleep after waking up in the middle of the night.
Which happens a lot.
It does. What's important here is to recognize if it's persistent, because sleep apnea is also a potential underlying issue that really should be investigated if symptoms are significant. It's a serious health concern.
Good point. Okay, so beyond the individual symptoms, menopause can have a broader impact on life. It often hits at the same time as other midlife stressors.
Right, like relationship issues, caring for aging parents, maybe career challenges.
It all piles on. And let's not forget the changes in physical appearance, which can be a real hit to self-perception.
Yes, definitely. With the decline in reproductive hormones, physical appearance can change. Things like thinning hair, dry skin, weight gain, maybe loss of breast fullness.
Yeah.
These can definitely challenge self-perception and body image. And it's a valid part of the emotional journey, you know? It's not just vanity, it's about how you feel in your own skin.
Totally valid. But here's where the source offers a truly refreshing perspective, something I found genuinely surprising. Despite all these challenges, it highlights some incredibly positive aspects that often emerge from this transition.
Yes, it's not all doom and gloom.
What were some of the biggest upsides you found in the material?
Okay, let's start with a huge one, the relief from menstruation.
Oh, yeah.
For countless women, this isn't just about no more periods. It's an end to years of, unpredictable bleeding, sometimes debilitating pain, water retention, sore breasts.
The whole monthly cycle.
Exactly. Even that monthly cloud of depression some women experience. Imagine the mental and physical freedom that brings it. It can be a profound shift for the better.
Absolutely. And, okay, contrary to popular belief, it seems an improved sex life isn't out of the question either. That's a surprising nugget.
It really is. The research indicates that actually previous sexual function and the feelings of partners are more important than the hormonal dips in maintaining sexual function at this stage.
Really. More important than hormones.
Seems so. The clear takeaway here is that open communication and having a supportive partner can truly trump biology in this area. Talk about it.
Wow. Okay. The source also mentions a reported increase in personal confidence. How does that manifest?
It's fascinating. Women in studies described feeling stronger, more in contact with their feelings, maybe having fewer inhibitions.
Like less worried about what others think.
Exactly. No longer feeling as restrained by others' views, feeling more assertive. It's almost like a liberation, a sense of, I've earned this wisdom and I'm going to use it.
I like that. And finally, more freedom. The empty nest thing can be mixed, but it also opens up new possibilities.
It can indeed. There's often a significant feeling of freedom in being able to concentrate on your own personal needs, prioritize yourself once adult children leave home.
A chance to refocus?
Yeah, savoring the space, both actual and emotional. It's a chance to truly redefine yourself, maybe pursue things you put on hold.
So we've laid out the physiological groundwork and covered some of the most common physical and mental symptoms, along with those unexpected positives. It's clear this isn't just a simple biological event. It touches every part of life.
Absolutely.
But now, let's explore beyond the immediate experience, because our source also digs into long-term health and powerful preventative strategies. This is really important.
It really is, because as you mentioned, estrogen receptors are found in many tissues beyond just the ovaries and breasts. They're in the heart, blood vessels, bones, bladder, skin, even your brain.
Right, which leads to a number of potential long-term health risks.
Precisely. A prime example is cardiovascular disease, or CVD. While women generally have a lower risk pre-menopause, afterwards, risk factors like high blood pressure, high cholesterol, being overweight, they become significantly more impactful.
So awareness becomes key.
Proactive awareness, yes.
But there's an empowering takeaway here too, isn't there? A lot can be done to protect your heart.
Oh, absolutely. Staying active, eating well, not smoking, keeping stress levels to a minimum. These things can really reduce your risk. It's a powerful message for you, the listener. You have agency here.
Definitely. Okay, what about cognitive function and dementia? That's a big worry for many people.
It is, and it's
Yeah.
important to clarify a common misconception. While, yes, forgetfulness is common at any age, and maybe especially for perimenopausal women dealing with fluctuating hormones and poor sleep.
Brain cog, right?
Exactly, brain fog. But it's rarely early Alzheimer's. Natural menopause itself isn't actually linked to memory decline in the long run.
That's reassuring.
However, risk factors for dementia do include age, being female, lack of estrogen later on, and importantly, conditions affecting the heart and arteries like diabetes, midlife high blood pressure or cholesterol, obesity, stroke.
So the heart-brain connection is strong here.
Very strong. But again, the positive news continues. Remaining physically, socially, and mentally active, maintaining a healthy weight, eating a balanced diet, managing conditions like diabetes and depression.
All the things we should be doing anyway.
Pretty much. And as always, quitting smoking is a huge benefit across the board. It really stacks up.
Okay. Breast cancer is another major concern. It's the most common cancer in the UK, right?
Yeah.
Mostly in women over 50.
That's correct. About 4 out of 5 cases are found in women over 50. Risk factors include increasing age, a close family history, having a late menopause after 55, or starting periods early before 12.
And things related to childbirth.
Yes, having a first child after 30, never having children, being overweight post-menopause, and not breastfeeding are also considered risk factors.
But here's some incredibly good news from the research, which I think is so important to share.
Please do.
Up to 40% of cancers are potentially preventable through diet and lifestyle changes.
40%, that's huge.
And twin studies even suggest that up to 85% of cancers could be prevented, meaning only about 15% might be purely down to genetics.
That puts so much power back in our hands, doesn't it?
It really does. Now, breast screening. The source talks about pros and cons.
Yes, it's important to weigh them. Positively, screening saves lives about 1 life from breast cancer for every 200 women screened in the UK. That's significant.
But the downside.
The negative aspect is overdiagnosis. This means about 1 in 100 women screened might receive treatment they didn't actually need for a cancer that would never have become life-threatening.
Which causes unnecessary worry and distress.
Exactly, especially from false positives. It's a complex balance, a conversation to have with your doctor.
Understood. Type 2 diabetes is another condition whose risk can increase around menopause, especially linked to weight.
Yes, particularly if you have a high body mass index or BMI, or if you carry excess weight around your waist.
But again, the good news.
Much like heart disease, achieving and maintaining a healthy body weight, getting regular physical activity, eating a healthy balanced diet, managing stress, these can all help stabilize blood sugar and significantly cut your risk.
So these lifestyle changes aren't just minor tweaks.
No, they're foundational changes with potentially huge impact on long-term health.
Okay, now let's really talk about empowerment through those lifestyle choices, because this is where you, the listener, can take real control.
Absolutely.
Our sources really hit home with this central message. Everything in excess is harmful. Moderation is key. So simple, yet so profound.
It's the golden rule for a reason, isn't it? The World Cancer Research Fund, or WCRF, offers clear guidelines for cancer prevention that are just, well, good for overall health.
Like what specifically?
Things like maintaining a healthy weight. Obesity is linked to several cancers post-menopause. Being physically active, limiting energy-dense foods, and avoiding sugary drinks.
And focusing on plants.
Yes, most importantly, eating mostly foods of plant origin. Aim for about 3 fruits and maybe 6 or 7 servings of vegetables a day. They contain protective compounds like lycopene, beta-carotene, vitamin C, flavonoids, all good stuff.
Building that plant-rich foundation.
Exactly.
They also recommend limiting red meat and avoiding processed meat entirely if possible, and limiting alcohol.
Right. For cancer prevention specifically, the optimum level of alcohol is actually 0, though UK guidelines suggest no more than 14 units of whey as a maximum.
Okay, and beyond that?
Limiting salt, avoiding moldy cereals or pulses. As for supplements, multivitamins, maybe some vitamin C, essential fats, those are often considered basics.
But be careful with high doses.
Absolutely. High levels of individual nutrients should really only be taken under professional guidance. Don't just guess. And also, if you happen to be a new mother during this time, breastfeeding is recommended for cancer prevention too.
Good to know. The source also highlights essential fatty acids, omega-3 and omega-6, for their anti-inflammatory effects.
Yes, both are important. Think oily fish, nuts, seeds.
Yeah, when we talk about energy density, they provide a great spectrum to help us make better choices day to day.
They do. Low energy dense foods like soups, salads, pasta, rice, pulses, lots of extra vegetables, they should make up most of your diet. They're filling but low in calories.
Makes sense.
Medium energy dense foods include things like sandwiches, pizza, moderate those. And high energy dense foods like biscuits, crisps, cheese, butter, enjoy them, but in smaller amounts. It's a practical way to think about balancing your plate.
And those low-fat and diet foods we often reach for, turns out maybe not the best strategy. It's a classic example of how marketing can mislead us, isn't it?
You've hit on a really important point there. Our source dives into this. These are often high in salt and sugar to make up for the flavor loss from fat removal.
Right, sometimes more calories even.
Exactly. And diet drinks, for instance, they've been linked to obesity, possibly because they disrupt the reward centers in our brains, maybe tricking them into craving more calories later.
Interesting. So the takeaway is,
It's often better to eat small amounts of enjoyable high-fat foods or non-diet drinks occasionally. Focus on quality and mindfulness over a diet label that might not be helping.
so really it comes down to mindful eating habits, like not skipping breakfast.
Precisely. Eating regular meals helps regulate energy and metabolism, prevents those blood sugar crashes that lead to poor choices later.
And the Mediterranean diet gets a good mention.
Oh, yes. That style of eating high in fish, fruit, vegetables, unsaturated fats like olive oil, nuts, seeds, low in dairy, meat, saturated fat has consistently shown benefits for dementia, cancer, and heart disease. It's a powerful blueprint for overall health.
Okay, exercise. Another foundational pillar. Crucial for heart health, mood, weight. We know this.
Yeah.
What's the recommended baseline?
The general recommendation is moderate intensity exercise, enough to raise your heart rate, break a sweat.
How often?
Aim for about 30 minutes, 5 times a week. That's the standard goal.
And are there specific nuances for menopause?
Yes, here's a valuable insight from the source. Gentle, stress-relieving exercise like yoga or Tai Chi is often better in the evening than more vigorous activities.
Why is that?
Vigorous exercise late in the day can sometimes be too stimulating and interfere with sleep, which is already a challenge for many. So gentler movement might be more beneficial before bed.
Makes sense. Mastering sleep hygiene is also vital, especially with those common sleep disturbances. What are the key strategies here?
Well, individual sleep needs vary, but most people need somewhere between 7 and 9 hours.
Well,
General advice includes sticking to a regular sleep schedule, even on weekends. Consistent wake-up time is key. Avoid large meals, high-impact exercise, work, and smoking in the evening. Limit daytime naps.
standard sleep advice. What about menopause specifics?
Ensuring a comfortable room temperature is particularly important. This might mean an open discussion with your partner, maybe using a fan, wearing wicking pajamas to manage night sweats.
Practical things.
And if significant issues like sleep apnea or restless leg syndrome are suspected, definitely seek medical help. Also, depression affects sleep, so addressing mood is important. And a practical tip for night waking. Deep breathing exercises can be surprisingly effective at calming the mind.
Good tip. Building a strong social support network is another area highlighted as critically important for overall health and well-being. Why does our source emphasize this so much?
It's because social support is just a powerful predictor of health outcomes. It's not just nice to have.
What kind of support?
It can be practical help, like someone helping with chores, emotional comfort, someone to talk to, informational guidance, maybe sharing experiences or resources, or simply companionship.
And there's science behind this.
Yes, research in psychoneuroimmunology, or PNI, which studies how our thoughts and feelings impact our physical health, shows that social support is directly linked to the optimal functioning of our physiological systems, including immunity.
Yeah, and especially important post-menopause.
Given the increased risk of cardiovascular disease post-menopause, its impact on heart health is especially significant. Connection matters. And here's a modern twist. Online support groups can also be very empowering and accessible for finding that connection.
Great point. And finally, communicating with your partner about what you're experiencing. This isn't always easy, but it sounds essential.
It's absolutely crucial. The source really stresses this. Educating your partner about menopausal symptoms can prevent so much confusion and frustration. Often, partners simply don't understand the huge range of changes happening.
Give them resources, maybe.
Yes. Give them this guy or other reliable info. Open discussion is key for addressing relationship issues and any sexual difficulties. And remember that surprising finding.
That previous function and feelings matter more than hormones.
Exactly. Previous sexual function and partner feelings are often more important than hormonal dips in maintaining sexual function. So talk it out. It makes a difference.
Okay, let's move on to the diverse paths to management, exploring various therapies and medications. Psychological and behavioral therapies sound incredibly relevant here, really driving home that mind-body connection.
That's a vital connection, absolutely. Stress triggers such a vast array of emotional, psychological, and physiological changes in our bodies.
Right.
And that field of psychoneuroimmunology, PNI, has extensively shown the profound impact of psychological factors on our immunity and physical health. It's not all in your head, in a dismissive way. Your head profoundly influences your body.
So cognitive behavioral therapy, or CBT, that's a well-known structured therapy, usually like 6 to 12 sessions, focused on changing unhelpful thoughts and behaviors.
Exactly. Developed by Aaron Beck. And our source rates it very highly for menopause.
How so?
It's truly a powerhouse. CBT has been robustly proven effective for reducing the impact of menopausal symptoms. It can improve sleep, mood, concentration.
And it's not hormonal.
Right? Non-hormonal, non-pharmacological, and very safe. And the great news is, self-help CBT options are also widely available now, making it really accessible.
That's great. And then there's hypnotherapy. How does that fit into menopause management?
Hypnotherapy involves inducing a state of deep relaxation where the mind is more open to positive suggestions and change. It's been shown effective for various things like pain, headaches, IBS, insomnia.
Okay.
But here's the surprising nugget for menopause. For hot flashes specifically, studies have shown remarkable results. We're talking a 68–74% reduction in some studies.
Wow, that's significant.
And importantly, with no unwanted side effects reported in those studies. So it's a significant non-pharmacological option to consider.
Interesting. Okay, shifting to complementary and alternative medicine, or CAM, the source advises caution, focusing on researched options and always telling your doctor right.
Absolutely critical advice. Always inform your doctor. Phytoestrogens, like those in soy and red clover, often come up.
What's the verdict on those?
Well, soy has mixed evidence for hot flashes. Some studies show benefit, others don't. Generally few side effects, though. There are some concerns for breast cancer patients on tamoxifen, so always check with your oncologist.
But it might be good for heart health.
Yes, it does seem good for heart health, helps reduce bad LDL cholesterol and increase good HDL. Red clover, specifically an isoflavone extract like Promensal, has shown more consistent results in some studies, like a 44% reduction in hot flash frequency and severity.
And other benefits.
Also potentially beneficial for bone health and heart health, worth discussing.
Calcium and vitamin D, essential for bone health, obviously. But there are nuances with supplementation.
There are. While diet is always the preferred source of calcium, vitamin D deficiency is very common and associated with many conditions, so testing your levels and supplementing if you're deficient is often recommended.
But what's the balancing act?
Here's a crucial nuance. High calcium intake from supplements, specifically, has been linked in some studies to an increased risk of heart attacks and kidney stones. So, while vitamin D and calcium together can be effective for fracture prevention, careful consideration and professional guidance are needed. More is not always better when it comes to calcium supplements.
Got it. What about other common herbal remedies? Evening primrose oil, black cohosh, St. John's wort, ginseng.
Okay, evening primrose oil has some evidence for reducing hot flash severity, but the findings are pretty mixed overall, not definitive. Black cohosh research is also quite mixed. There's just not enough convincing evidence for its overall effectiveness in menopausal symptoms, although earlier concerns about liver toxicity now seem unlikely based on more recent reviews.
What about St. John's wort? That's known for mood.
Yes, and it is effective for mild to moderate depression. The interesting part is it can also reduce hot flash frequency and severity and improve psychological symptoms and sleep related to menopause.
That is a catch.
A big one. It can interact with many other medications, including antidepressants, birth control pills, blood thinners, so critical caution required. Always, always consult a doctor or pharmacist before taking it.
Okay, and ginseng?
Ginseng is complex. There are different types. Some studies show potential cognitive and cardiovascular benefits, but more research is needed specifically for menopause symptoms.
Right. Traditional Chinese medicine, or TCM. What does our source highlight there? Things like herbs and acupuncture.
Yes. Chinese herbal medicine, which involves personalized formulas, has small studies suggesting it might benefit hot flashes. Acupuncture has mixed evidence specifically for hot flashes, but
But good for other things.
yes, there's strong evidence for its effectiveness in general pain relief. The World Health Organization actually supports its use in over 40 different diseases and conditions.
And Tai Chi?
Tai Chi is another powerful one from TCM principles. It's shown to improve quality of life, reduce anxiety and depression, help prevent falls, maintain heart health,
Wow.
and it's even been investigated specifically for helping with osteoporosis in postmenopausal women. It's a great mind-body practice.
What about reflexology and homeopathy?
Reflexology, which involves applying pressure to feet or hands, may be advantageous for sleep difficulties, according to some smaller studies. For homeopathy,
Yes.
the source is quite clear here. It's really unclear if any perceived benefits are due to the remedies themselves or the whole therapeutic package. The time spent with an empathic practitioner, the belief it will work, essentially a placebo effect.
So no strong independent evidence.
No strong independent evidence for its effectiveness in menopausal symptoms specifically. It's important for you to be discerning about where the evidence lies.
Okay, so with all these CAM options, how do you find a reputable practitioner? It can feel like a confusing maze in itself.
It absolutely can. The key insight really comes down to regulation and research. Psychologists, for instance, are heavily regulated by bodies like the British Psychological Society or similar bodies elsewhere.
But not all CAM practitioners are.
Exactly. Hypnotherapists, for example, are often not a protected title, so it's crucial to research professional bodies through resources like the Hypnotherapy Directory or equivalent registers.
And for others.
Look for registration with voluntary regulatory bodies, like the CNHC in the UK, or similar organizations that require certain standards. Always ask about their qualifications, which professional bodies they belong to, and the costs involved upfront.
And be wary of claims.
Definitely. Be wary of proof cited only by the clinic itself without independent, peer-reviewed research to back it up. And most importantly, always, always inform your main doctor about any complementary therapies you're trying. Herbs, especially, can interact with conventional medications.
Crucial point. Okay, let's shift gears to medical management options, starting with a big one. Hormone replacement therapy, or HRT.
Right.
It's certainly a topic with a lot of history, evolution, and often a lot of misinformation floating around.
Indeed. It's had quite the journey. The simplest way to frame it now is that HRT is widely considered the most effective treatment for vasomotor symptoms. That's hot flashes and night sweats.
Okay, number one for those.
Yes. And it also helps significantly with associated sleep disturbances, vaginal and urinary symptoms, and it's very effective for preventing osteoporosis, bone loss.
But it has that history
Yeah.
that scares.
Exactly. Its history evolved from early widespread promotion, fueled by books like Feminine Forever, to later large studies, particularly the Women's Health Initiative, WHI, in the early 2000s, which initially raised significant concerns about breast cancer and heart disease risk.
And that scared a lot of people off HRT.
It did. But the understanding has significantly evolved since then. With reanalysis of that data and newer studies, we understand the risks and benefits much better now.
So what is the current nuanced understanding of the risks versus benefits? Give us the digestible, what you absolutely need to know version.
Absolutely. The core message from current guidelines is this. For symptomatic women who start HRT before age 60 or within 10 years of their last period, the benefits generally outweigh the risks.
Okay, that age timing is key.
It's a key factor. Think of HRT as a significant tool for managing those disruptive hot flashes, improving sleep, protecting your bones long term. Now, are there risks? Yes, like any effective medication.
What are the main ones to understand?
Okay, the source highlights a small actual risk of breast cancer. This is primarily associated with combination HRT, the type that includes a progestogen, and the risk increases slightly the longer you use it.
But it's small.
It is small in absolute terms, and importantly, the risk decreases after stopping HRT. Also, some newer studies suggest that using bioidentical progesterone might carry less or possibly even no increased risk compared to older synthetic progestins, though more research is ongoing.
Okay. What else? Blood clots?
Yes, there's a slightly increased actual risk of blood clots, VTE, and stroke. This risk seems to be higher with oral HRT pills and is highest during the first year or two of use.
And transdermal is different.
Transdermal options patches or gels appear to carry a lower, possibly even no significant increase in clot risk compared to oral HRT because they bypass the liver. That's a really important distinction.
Good to know. Any other risks?
A small increased risk of ovarian cancer is also noted with current use, which increases slightly with duration but decreases after stopping. Lung cancer results from studies are mixed.
So the key is focusing on small and actual risk.
Absolutely. Don't get bogged down by the alarming relative risk percentages often reported in headlines. Focus on the actual absolute numbers, which are usually very small for most women in that under 60 within 10 years group. It's about a personalized conversation with your doctor, weighing your individual health profile against the potential benefits for your symptoms and bone health.
That's a crucial distinction, actual versus relative risk.
Mhm.
Okay, in terms of types and administration, the source mentions different estrogens, progestogens, and ways to take them. What's the practical difference for the patient?
Right. The main estrogen used in regulated HRT is ostergaol, which is identical to what your ovaries produced. Progestogens, either progesterone itself or synthetic versions called progestins, are crucial if you still have a uterus. They protect the lining of the womb from thickening too much due to the estrogen.
Okay, so estrogen plus progestogen if you have a uterus.
Generally, yes, estrogen alone if you've had a hysterectomy. The practical difference for you is often how you take it, orally as pills, or transdermally via patches, gels, or sprays applied to the skin.
And the advantage of transdermal again.
The main insight is that transdermal options bypass the liver first-pass metabolism. This is thought to be why they likely carry a lower risk of blood clots compared to oral pills. They can also provide more stable hormone levels for some women.
What about other hormones sometimes mentioned, like testosterone and DHEA? Are they common additions?
Testosterone is sometimes prescribed off-label, usually as a gel or cream, specifically for women experiencing hypoactive sexual desire disorder, HSDD, that's causing distress, especially if it started after menopause or ovary removal.
Does it work? Are there side effects?
It can be effective for low libido in some women. Potential side effects like acne or unwanted hair growth can usually be minimized by using the correct low dose appropriate for women. DHEA is available as a supplement, sometimes suggested for low levels, but study results on its effectiveness for menopausal symptoms have been inconsistent, so its use is less clear-cut in standard guidelines.
Okay. In the debate about bioidentical versus compounded hormones, this can be super confusing for patients. What's the key difference?
It absolutely can be confusing. The key insight from major medical societies is this. Regulated body-identical or bioidentical hormones like the oestradiol, micronized progesterone, and testosterone preparations prescribed by doctors and dispensed by standard pharmacies are supported. These have undergone rigorous testing for safety, efficacy, and consistent dosing.
And compounded hormones.
Compounded bioidentical hormones, often called BHRT, are custom mixed by special compounding pharmacies, often based on saliva tests. The concern here is that these specific compounded mixtures generally lack the large-scale safety and efficacy studies that regulated products have. Dosing can also be less consistent.
But they offer personalization.
They do offer personalization, which might be appealing for specific needs like allergies to ingredients in standard HRT, or if someone wants a specific type of estrogen like oestradiol. But the lack of robust safety data is a key point of discussion with your doctor. Understand the difference between regulated body-identical HRT and unregulated compounded BHRT.
Very important distinction. Okay, beyond hormones, there are also non-hormonal medications that can help manage symptoms, right? What are some effective alternatives if HRT isn't suitable or desired?
Yes, absolutely. There are good options. Certain antidepressants have been found effective for hot flashes. SSRIs, selective serotonin reuptake inhibitors. Escitalopram, for instance, may be particularly effective, according to some studies. They can be a good alternative if HRT isn't suitable, but they can have side effects like nausea, drowsiness, or sometimes decreased libido.
And other types of antidepressants.
SNRIs, serotonin norepinephrine reuptake inhibitors, like venlafaxine, have also been shown to reduce hot flashes. Lower doses are often preferred to minimize potential side effects.
What about non-antidepressants?
Gabapentin, which is actually an anti-epileptic drug, is also proven effective for hot flashes. However, its use can be limited by side effects like dizziness, fatigue, or drowsiness for some people. Another one is clonidine, which is a blood pressure medication. It can also reduce hot flash frequency and severity for some women.
So definitely non-hormonal prescription avenues to explore with the doctor.
Yes, several options exist.
For osteoporosis, the bone-thinning condition, bisphosphonates are often mentioned as a first-line therapy. How do they work?
Bisphosphonates, or BPs, work essentially by slowing down the cells that clear away old bone. This helps preserve bone density and reduce fracture risk, especially in women at high risk.
And they have long-lasting effects.
An interesting point is that their effects on bone can continue even after you stop taking them, which sometimes allows for a planned treatment holiday after several years of use, under medical supervision, of course.
Are there downsides?
Like all drugs, they can have side effects. Some gastrointestinal upset is possible. More rarely, there can be issues like osteonecrosis of the jaw, ONJ, particularly with higher doses used in cancer treatment or after dental surgery, and very rare atypical fractures of the thigh bone. These risks are low but need to be discussed.
And bone density is measured how?
Bone mineral density, or BMD, is measured using a DICASA scan, which is a type of low-dose X-ray. The result gives you a T-score, which compares your bone density to that of a healthy 30-year-old. It's the key diagnostic tool for osteoporosis.
Okay. Finally, what about diagnostic tests? What might your doctor recommend to personalize your approach to menopause management, and what do these tests actually tell you?
Right, tests can be helpful. Your doctor might measure hormone levels, FSH, oestradiol, progesterone, testosterone. They might also check thyroid hormones, DHEA, and vitamin D levels.
Is blood testing best? What about saliva tests?
There's an ongoing debate about whether blood or saliva testing is more accurate for sex hormones like estrogen and progesterone. Blood testing is the standard in conventional medicine. Saliva testing is often preferred by alternative practitioners, especially for stress hormones like cortisol, as it can measure levels throughout the day easily. The key insight, though, is that consistency in the testing method used is crucial if you're tracking levels over time for comparison.
Good point. Why test thyroid function specifically?
Because both an underactive thyroid, hypothyroidism, and an overactive thyroid, hyperthyroidism, can cause symptoms that closely mimic menopause, things like fatigue, mood swings, hot flashes, palpitations, changes in periods. It's really important to rule thyroid issues out or treat them appropriately, as they can make diagnosis tricky otherwise.
Makes sense.
Yeah.
Any other useful tests?
Urine testing can sometimes be used, particularly in functional medicine, to look at how estrogens are being broken down or metabolized in your body. Specific metabolites like 2-hydroxyestrone, 2-OHE, and 16-alpha-hydroxystrone, 16-alpha-OHE1, and their ratio have been linked in some research to breast cancer risk.
Interesting. What about scans?
Vaginal ultrasound scans are sometimes used mainly to monitor the thickness of the endometrium, the womb lining. This is especially important if you're on HRT or experience any unexpected postmenopausal bleeding.
And anything else blood test-wise?
Homocysteine levels might be checked. Elevated levels of this amino acid are linked to an increased risk of cardiovascular disease, cognitive decline, and osteoporosis. But the good news is that high homocysteine can often be lowered with specific B vitamins like B6, B12, and folate. So these tests can really offer a personalized roadmap for prevention and treatment.
So we've covered a huge amount of ground in this deep dive.
Yeah.
You, our listener, now hopefully have a much clearer roadmap for navigating menopause, drawing on scientific evidence and practical strategies.
Yes. And the ultimate goal, truly, is empowering you to make informed choices that are right for you. It's not one size fits all.
Absolutely. And to maybe recap some key takeaways for your action plan.
Definitely. Always start with diet and lifestyle changes. They are truly foundational. They offer immense benefits for symptoms and long-term health. Don't underestimate their power.
And consider psychological and behavioral therapies like CBT and hypnotherapy. As we heard, they've been shown to really help with things like hot flashes, sleep, and mood without medication.
Right. And when it comes to HRT, remember, it's the most effective treatment for vasomotor symptoms. Discuss its benefits versus risks thoroughly with your doctor, paying close attention to your age and time since menopause. And always focus on that actual risk, not just the scary relative risk headlines.
And if HRT isn't suitable for you or you choose not to use it, remember there are those non-hormonal medications that offer effective alternatives. You always have options.
And please, prioritize your bone, heart, and cognitive health with targeted lifestyle choices and, if needed, specific medical treatments. This phase is really about building your platform for long-term health and well-being.
Finally, don't hesitate to utilize those diagnostic tests we talked about to personalize your approach and truly understand what your body is telling you. Knowledge is power.
Well said.
What an incredible deep dive. This idea that menopause is truly a time of change, both mentally and physically, as well as spiritually, and that, a significant portion of a woman's life is lived after it. It really shifts the whole paradigm, doesn't it?
It really does. It reframes it completely.
It isn't just about managing symptoms then. It's bigger. So here's a final thought for you to maybe mull over. What does this all mean for you? What aspect of your health, your well-being, or maybe even your life purpose will you reassess today, knowing that this is such a pivotal time to consciously build your best possible future self, maybe with renewed energy and even vigor?